Hi everyone, my name is Sharan Tapia. Welcome to you Multicultural channel. Today we have a very special guest with us, Dr. Kerenjeet Sandu, who is a family physician and specializes in addiction medicine. Welcome, Dr. Kiran. Thank you for your time.
Thank you for having me. I'm very excited to be here today.
Great. Tell us something about yourself, a little bit about yourself.
So I'm from Winnipeg. I practice family medicine and addiction medicine at 3 different sites. So I have 2 clinics that I work from, and then I also work downtown at the RAM clinics.
Okay.
And I also am on faculty at the University of Manitoba to teach the incoming physicians more addiction medicine. So I have quite a few roles in the community, and in the last few years I've started working more with the Asian community.
Great.
And so that's been a focus of mine, especially with being able to speak Punjabi, and so focusing on just supporting mental health, addiction, substance use in the Asian community.
So, Dr. Kiran, where did you find the passion for addiction medicine? Why is that?
So I think the passion developed, I had spent a lot of years in my childhood going back to India. My parents are from Punjab. And so in the process of meeting my family and developing that bond, I realized that there's a large need for health services in general in Punjab. And from that need came this motivation and passion to serve my community. And so in 2013, after having completed my training, I returned to Punjab to do this work. And upon my return, is when I realized that there was a large need for supporting and treating opiate addiction in northern India, in Punjab.
Oh, wow.
And so that's how this whole ball started rolling. And then upon my return to Winnipeg, I continued my practice. And actually my practice exponentially grew because there is a large need for physicians to do substance use work in the Asian community.
So why this is expanding, especially in Asian community? Our youth is going so much towards drug abuse, and parents are suffering. Why is it happening, you think?
So I think the reasons are multifactorial, and I spend a lot of time with my patients. You know, we have patients come in, we work with family members, we work with the patient obviously, and then of course the family, extended family. And I think the reasons are multifactorial. You sometimes in immigrant families, you have newcomers here, students. Typically they're alone, lots of burden, financial burden, work burden, stress, and then not really great coping skills. So they don't have great coping skills, and then they have all this stress. And the combined factors, they sometimes turn to not good ways to cope. And one of the not good ways to cope typically is substances, be it alcohol, be it pills, be it, whatever we can find.
Right.
So these kids or youth start talking to each other, and then word spreads, and before you know it, they're all coping the same way. And that's not a good way to cope. And then when the family members show up, or if they're already here and they find out, that's when the suffering begins. So, that's why I always say addiction is a family disease. It doesn't affect one person.
Right.
It affects that entire family and others too. So I think there's multiple reasons why youth are getting into this. And then the other side of it is prevention and education. Our goal is to provide education about why these things are bad. How can you prevent some degree of substance use? And then if we can work on the education prevention, then hopefully our numbers towards people actively using would be less. That's the goal.
So I think it's a major challenge as a parent if you don't know how to deal with it. Or sometimes parents are the last person to know if this is happening. How you teach or educate new immigrants on that?
So I think one of the biggest things that I find culturally, even for us growing up in our culture, in our homes, is the communication barrier. There just isn't a lot of space and room to talk. Typically in our homes. Now that's not necessarily a bad thing, but in this particular case, it can work against parents because they have children that then become closed off, don't want to share their feelings, and then don't want to share when they're in trouble, struggling, suffering, or using drugs. So you just have to, I think what we try to teach these families is open that door for communication early on, right? So again, that's the prevention. When you've got the young kids in the home, the 5, 6, 7-year-olds, fast forward 10, 20 years, and you want to be able to have that open line of communication. So your 5-year-old, when they're a teenager, can come and say, I'm struggling with this. So I think communication and having better boundaries and better coping skills are some of the key aspects of what's lacking in the community right now.
Right, because I'm sure as a physician, you are facing people when there is a problem. Nobody
Yes.
wants to see the doctor
Yes.
unless there's a problem.
Right. So we typically are at the point we intervene when they come to our door, and typically patients come to our door. I always say to my staff, especially with addiction, it's hard to accommodate everybody. But I always say if we know someone's coming in that state of mind, we cannot turn them away because we don't know when they're going to make the effort and be
Right.
motivated enough to come back to that door. So entering the door, I always say, you've come through my door. That's a big step.
Right.
And so I think the biggest thing is they come to us and they're already in that chaos, right? The
Yes.
job is gone, the money is gone, they're
Yes.
using every day.
Yes.
And so we are, doing things like this, talking about it, destigmatizing substance use helps us work more on the prevention in the families so
Right.
that we can avoid that utter and complete chaos of when, patients show up.
So is there any effort within the community where we are teaching parents especially how to deal with it? Any program in the schools?
So
Because as you said, prevention is better.
Prevention is
than
better, yeah. So at the level of junior high and high school, in terms of language-specific programs, especially for these parents that may not be as fluent in English, I think that's a barrier.
Right.
So I think language is a barrier for us in some settings. And so I think the key is especially with the immigrant families, is having things like parenting workshops. There
Right.
recently was a parenting workshop.
Okay.
And there are lots of community services coming up that are starting to offer different workshops for parents on how to better their dialogue with their children, how to better communication in the homes, and how to create an environment that allows that open communication. So I think these things are coming up, but I also think that there needs to be more of them. There need to be more education and prevention programs in local high schools and junior highs so that we can spread the word and really kind of talk about the untalked about topic, right?
Right.
A lot of people don't want to talk about substance use and addiction because there's a lot of shame. I have a lot of families that come in, and why do they come in when they're in absolute chaos? Because the whole time they're so shameful. Okay, how could I do this? They're so guilty. So that guilt and that shame is what prevents them from seeking care. And so we're also trying to work on destigmatizing. Let's take the stigma away from substance use in our communities. Let's offer these people the treatment that they need, right?
Yes, and I'm just from a parent's point of view, I'm thinking, when we have a baby, we're starting
I
from
know,
start,
right?
Right, when we have a baby, and then you are learning as a parent how to take care of the baby, and as a parent, you are providing nice atmosphere to raise that child, and then child goes to school or college,
Yeah.
and then the last thing you find out, or the last person you are to find out, the child is in trouble.
They're in trouble, yeah.
So in this whole process, starting from home to school to the college and the drugs, who you think is where the responsibility should fall?
Where
Who
should it
we
fall? Yeah.
blame? Is there I shouldn't say blame
yeah.
in the sense, but the thing is, when we speak with so many parents and as families, parents are always thinking they're learning bad habits in school.
Yeah.
So does the responsibility falls on the teachers, the school system? And there might be something from the home too, but anybody who taking drugs, even if it's youth or older person, there is a problem, right?
Yes.
So where you see as a profession that where we are missing, but what is the missing piece here, where we can save our kids from going through these
hard times, yeah.
Hard times.
So I think the answer for that question falls on a lot of different things. I don't think it's one individual. I think teachers obviously do their best to create good atmospheres and good education for children. I think, in our homes, again, going back to what our homes should look like for our kids, not should necessarily, but offering our children the support they need, So one of the big things in today's society, Sharon, is just devices, social media. So think about when I grew up, 30, 40 years ago, and then you have what we're dealing with now. So you have kids in school that are bombarded with Facebook and all these different portals.
Yes.
And then they're bombarded with what they should be, what they could be, and then what they actually are. So there's that identity crisis.
Yes.
Combined,
and the peer pressure.
And peer pressure. Combined with that, you then have these pressures from home. Educate yourself, get a good education, especially in our families, right? We come here as immigrants to strive and be very academically very
Yes.
successful.
Yes.
And that's just sort of the nature of the story. And so comes with that a lot of pressure for these children. So I think it falls in multiple places. Sure, it can fall on the teachers and the school systems and all that. I think in our homes, the biggest thing for me that I try to offer my families is let's have some presence of mind. When we are sitting at the kitchen table, when we are sitting with our children after school, no devices, no phones, no iPads, just one-on-one time. Your child needs to feel like you're there, not just there,
Right.
there, and just connecting with them so that they understand that, oh, she's here, she's sitting with me. Maybe I could share something with her now, because we're creating that space. There has to be room to have these uncomfortable discussions, right? If life is so busy and chaotic and we're constantly on our devices and we don't offer each other the communication and the space, then we aren't going to see change, right? Change has to come from within, from ourselves, if we want this next generation to flourish and thrive and not suffer. So I think that's a key part of this.
I think culture makes a difference as well. As you said, within our Asian families, there's so much pressure from the parents.
Yes.
They wanted their kids to do this and be the doctor or engineer or be the best and not to go near alcohol or, all those high expectation. You think because of that pressure as well?
I think it plays a role. I'm not going to deny that it doesn't play a role. I think there's a way to sort of create pressure. Back when we were growing up, it was just something you did. Doctor,
Right.
engineer, lawyer, take your pick.
There was no other pressure. There was no
There's
other
no other
profession.
job, right? And so you fast forward now some 20, 25 years, and of course the world has changed drastically.
Right.
But I think we need to, offer, it shouldn't be this thing about go get an education so you can make a lot of money and you can buy really nice cars, We sort of want
And then
to
have a nice wife and kids.
and have that picture perfect life. We again want to offer our children and this future generation just the ability to grow and flourish and have access to what's available in the world, even if it doesn't fit in that box anymore. And I feel like, compared to when my parents first came here, I feel like the box has changed, right? I'm first generation. My concept of what my child should be doing and becoming is very different compared to my parents. So I think the change to some degree is inevitable, but at the same time, there are ways for these families to integrate a different approach with their children so that those children aren't facing those kinds of hardships.
So I think you are saying indirectly that we need to go back to basics
Yes,
as well.
absolutely.
It all starts from home.
From home.
So parents need to give unconditional love
Yes.
and support the child,
Yeah.
just like a plant or a flower.
Yeah.
All you need to do is nourish that flower
Yeah.
and let it be.
Let it be.
Instead of putting so much pressure.
Yes. And we have to realize it's not going to be perfect. There aren't
Yes.
going to be. It's not like there's not going to be a hiccup in the road or there's not going to be some hill we have to climb. That's part of life. That's part of creating this next generation of human beings.
Right.
But at the same time, we have to have the ability to cope and deal with the hiccup and the hill and whatever comes our way, right? And then, of course, a sense of community.
Yes.
I feel like, again, the other piece of community is we have to be able to talk to each other. We have to stop thinking, okay, I can't discuss this, I can't share this because what will society think, what will people think? We want to kind of take that umbrella away and allow more of an open space and forum so that families can talk to each other and share some of these struggles, right?
So you think family structure, because family structure changed as well.
Yes.
So when we or you and me, we grown up, that time we had grandparents
Yes.
in the house,
The joint
auntie,
family.
uncles. There's always somebody to talk to. And now kids are sitting home alone. Both parents are working, and kids are sitting home alone or in the daycare. And then there's not enough connection or attention from parents.
And maybe in that sense, I sometimes feel like maybe I'm lucky because I can carve some of that time out just based on my schedule and how my job is set up. A lot of people can't do that. So
Yes.
sometimes what I do actually, because I have my parents here, is I will, I'll take my daughter from school. She's in, she's kindergarten, so it's younger, but take them out of school and get them to spend some time with family members.
Right.
Right? If you can accommodate that in your schedule, because that's what allows that sense of community and family. Otherwise, you're right, you have kids alone in schools or at home. So again, trying to just change the dynamic a little bit because family homes, they have changed, right?
Yes, Yes. So you think there are some natural remedies are responsible in the Asian culture?
Yes,
Can
absolutely. I feel like there's other ways that we can also cope. You know, when we're talking about substance use or addiction in general in the Asian community, it's not always about waiting till the chaos comes, right? There are ways you can prevent and
Yes.
support your bodies. And so
Yes.
again, with coping, I always talk to my patients about what are you doing, what are you putting in your body, first of all.
Right.
So diet, supplements, right? Are you drinking enough water? It's pretty basic stuff, but you'd be surprised at how many people forget the basics, right? So what are you putting into your body? And then of course, what are you doing with your body? Exercising, meditating, what do you do to support a good sense of mental health, right? Because it's when we lose the good diet and the mental health that things start to go downhill, right? And that's when things get really bad. And people usually turn to some degree of substance use, in some cases, not all cases.
Right.
And so I always counsel my patients on that piece. Okay, we're getting you out of the addiction. We're treating the addiction. What does the rest of your life look like? What is your job like? What is your family
Right.
like? What are your stressors? Are there financial stressors? Are there spousal stressors? What do
Yes.
you eat during the day? Do you exercise?
Right.
It's very basic stuff, but you'd be surprised at how not talked about it is when someone's in crisis.
Deep stuff.
Yes,
Because
very.
if your child is suffering, you are suffering as a parent.
Yeah.
And I'm sure parents are feeling the shame that something
Yeah.
they didn't do right.
Yes.
So in your profession, you are not only dealing with the patient, like a youth, you are dealing with the adult as well,
Of
the
course.
whole family.
Yeah. So we deal with the parents. You know, some of the parents are depressed. Some of them can't sleep at night. Some of them have anxiety, insomnia. Like there's so many facets to this disease process. You know, and I always say to my patients, it's like an onion, you know. When you start peeling an onion, how many layers are there? So many layers.
Oh my goodness.
It's the same
Yes.
thing with a family, right? And so you really have to peel back those layers and kind of understand the people, the individuals involved, and then support them as best you can. So I always say to parents, you know, stop, like let's take that guilt away. It's not your fault, right? It's, first of all, people need to really understand addiction's a disease. And so there's a genetic component to it, and then of course there's a component of society to it. But it's not something you necessarily did, right? I really try to help parents understand that guilt, that feeling of shame, neglect, all those feelings, you know, we have to work through those, right?
Right.
They're there, they're very real. We have to work through those, right?
So because we both from Punjab,
Yes.
a different culture. So you think culture is playing a big role when alcohol is very common
Yes.
in our Punjabi households? I know when my kids were teens, many of my kids' friends, they don't see alcohol in their houses.
Yeah.
And I think every Punjabi household has a area, bar
Yeah.
area. And we never try to lock any drink or put it away. If we are having a drink, our teenagers were right there, you know. And I remember we never hide that we are not drinking, and we didn't want our kids to hide this.
Yeah.
You think because alcohol is right there available, especially, and then you see many youth suffering from alcohol as well. It's not only drug
No,
or
I see
substance.
lots of alcohol. And I think alcohol use or the alcohol addiction obviously comes from the fact that culturally it's so normalized. It's normal to drink during the week. It's normal to have parents drinking, right? It's also normalized that, of course, these youth see it. It's accessible, like you said. We don't lock it up. It's there. And you're not going to lock it from 17, 18-year-olds anyway, right? So it's there, it's accessible, and then, of course, that's the start, right?
Because
So
we didn't want to lock it, so, okay, this is locked and you cannot have it and we can.
Right.
You know, we didn't want to give that.
Yes. And then it starts from there, and then, of course, you know, even now with cannabis being legalized, right?
Oh
So
my
it goes from there, and then, of course, this is legalized. Oh, so if that's at Liquor Mart and this is at the store, then they both must be okay. But it's, what is it doing to your body? What's the quantity? What's the frequency of use? That's what it comes down to, right? And so that's where the discussion needs to be had, right? And typically those discussions are not had in our homes because a lot of the time, especially in some cases, you have the dad saying or the mom saying, well, come sit down and have a drink with me. Again, during the week or something, right?
Right.
That's when you talk to the family, you pick up the habits. And then you're like, okay, how are we going to break these habits now?
Yes.
So that's all part of it. The circle starts somewhere, right?
Yes.
And culturally, there are some things that have sort of led, especially Punjabi community, more towards this substance use. That is obviously a given fact. Yes.
So you're seeing Punjabi community because of the household atmosphere or having drink as a normal thing.
Yes.
Do you see there is a more increase in Asian community, especially in the Punjabi community?
Yes.
For this compared to other?
Yes. Huge.
There is?
Yes, there is.
Oh.
So especially for me, like I speak the language, and patients come to me because if they can't share what they're going through in their native language, then that's a barrier.
Yes.
So we're trying to take the barriers away. So that's why I have 3 sites, so patients can access me in more than one place. And so yes, I would say the Punjabi influx of patients that I've seen is massive. Massive.
Oh my goodness.
And it continues to grow. It's become so culturally accepted to use any substance that and it interferes with their lives. So when it's not interfering with your life, sure, it's great, right? Makes you feel good, you get a little bit of dopamine, all good. It's when it interferes with job, money, and your life, that's when we see them. So that's the problem with using substances to this degree, right? Otherwise, typically these things are meant for enjoyment to a degree. The problem is where is that line between enjoyment and problem? And that's where we see these individuals. And yes, I would say right now in the Punjabi community of Winnipeg, we have a large problem. Manitoba, I would say. I have patients come from outside Winnipeg. Okay. So it's a very big problem, especially for the immigrant families coming in that are here on work permits, trying to get their PR. They leave Winnipeg to get their immigration stuff done outside the city, and then they need care. Yeah, it's a very big problem.
So what would you like to advise parents who are going through this, or young parents?
Yeah.
What kind of suggestion you will give so we are doing the right thing first?
Yeah, so I think the biggest thing is keeping the communication in your homes as open as you can. If you don't know how to do that, talk to somebody like me, counselors, other people in the community, support workers, volunteers, whoever you can, about how to begin opening that line of communication. That's your prevention right there. There's your prevention and your education. And if you're in a crisis and you're struggling, then you need to seek out somebody like myself who can support you through the treatment aspect of it. So the first thing you have to do is get the patient out of their own way, because they can't see anything at that point. So the treatment is the sort of getting them out of crisis. And then after that is working with the family. So I say reach out. Let's start creating a dialogue that allows these families to want to get help.
So I want to go one step back here.
Sure.
So as you said, patients don't see themselves.
Yes.
But sometimes I'm seeing parents don't even see that their kid had a problem.
Yes.
Or they don't want to discuss it, even with the doctor, even if it's confidential.
Yes.
So if the parents don't understand that the kid is having a problem and they are not accepting, how you deal with that part? As a, let's say, some people are going through so many problems, but sometimes as a friend, I'm seeing that my friend's son or daughter have a problem. And as a third person, you don't want to say something, or even if you say something, they don't see this as a problem.
Right.
How you advise those people how to come forward and remove this taboo of not accepting, because acceptance is the first step in healing.
It's all of it. Yeah, so one of the things that I like to do with families in this particular situation, when I have a resistant parent or a sort of more difficult case, you could call it, is I try to point out some of the deficiencies or the problems that we're already seeing in the patient. For example, kids in school, grades are falling.
Yes.
Lack of friends. I have some cases, cutting. They start self-harm.
Oh my goodness.
Yeah, lots of stuff we see in the community. So I try to highlight some of those in the current situation so that the parent, one of the things you have to be careful about is blame. Oh, you don't see this? How do you not see this? So the finger pointing and the you is going to shut them down. So you don't want to say, well, you don't see this, and how come you don't see this? And it's more of an attack. You want to say, I'm here today for this individual, and this is what I've seen and noticed. How can we work on this so that they can get better grades, or so they can flourish in school, or whatever? So you're focusing on the individual, not necessarily the parent. But indirectly, you will address the parent or the adult in the room at some point. And it's not like a one-time visit, like in 15 minutes they're cured.
Right.
You have these
Right.
families come in over weeks and months. And sometimes it takes me 2-3 months to just get a parent to start talking. It is a process. Right. And that's why we want people to be able to reach out to us and feel like they can talk about it. One of the other big things is I have a lot of patients who are drivers. They don't want their license taken away. We're not going to punish you for coming for help. Hana. We're not going to say you're coming for help and we're going to take your license away and take your job away and take your money. No, that's not the goal. The goal is to give you your life back, not to further take your life away from you. Hana.
Right.
We want them to feel empowered by their choice to come for care. Right. That's the goal. So it's a stepwise approach, I think.
So as a profession these days, there's so much waiting room in the doctor's office. So how you handle all these things and give everybody so much time, because we all know our system, healthcare is in a big trouble in Manitoba.
Yeah.
So people coming with the problem and they need time, and sometimes I'm seeing doctors are rushing, and you are saying, come and talk to me, and doctors keeping everything confidential.
Yes. So confidentiality is a big part for me. Like I want people to feel safe, and so I always make that clear.
So you don't rush people, okay, next.
Well, it's a different, so my model of practicing medicine is very different. So if I'm covering walk-in care, then it's just walk-in, right? And that's usually fast-paced because that's the nature of walk-in. If I have a booked addiction day, then I don't do addiction medicine appointments in 15 minutes. It's just not possible.
Oh, I see, okay.
So my schedule is set up in 30 to 45-minute blocks.
So one is like as a physician, you are in that clinic, and then this is a specialized clinic.
Yeah, so I can template my schedule to the way I want it. So let's say it's a Wednesday afternoon and I'm doing addiction that day.
Okay.
Then it's only 30-minute appointments. And I've trained my staff at both my sites so that they know that this particular patient needs this much time, or the chart is flagged, or I'll tell them ahead of time, this family's coming in and I need this much time. So I have to prearrange it. Now, it is a fast-paced profession. But for this particular situation, you just have to take the time. So I do spend evenings and sometimes weekends working on my schedule and having to make room for these families.
Right.
Because I'm one person, and I can't be a counselor and a social worker and a nurse and a doctor. So I do try to get some community support, obviously.
Of course.
But arranging all of this does take time, and I just have to put in that time. But that's part of the gift of giving in this thing, right? I mean, it's my job, but there's a whole other side of it that's just my passion for trying to get these individuals out of the throes of addiction, because it's like a magnet, right? And they're just so stuck.
Right.
So I'm very passionate about trying to get them out, right? I say one life saved is somebody's son, somebody's daughter, somebody's brother. It makes a huge difference to these people.
And now you have one daughter as well,
Yes.
5 year in the kindergarten,
Yes.
you were saying. So as a mother, it's a devotion to raise our kids.
Yes.
Right?
And a privilege.
And a privilege
Yes.
too, of course. It's a blessing from God.
It is.
So what message you want to give to all the moms there who really, gone through all this pain to give birth, and then given their young years to raise that child? What message you want to give them? And also I'd like you to let us know, because our audience are Asian, especially, and from different cultures, different languages.
Yes.
So, and as you said, language is a big barrier too. So similar help is available doctors are available in different languages as well?
Yes, at different clinics. I probably don't have as much of that information or resources, but I am a good point person. Okay. So if you ever need support or need that sort of more guidance into which way to go, then I'm a good person. If it's not me, then I'll figure it out. We won't turn people away for this particular issue, because, for any issue really, but in particular, this is very important to me. So obviously we won't turn people away. So I'm in Transcona, I'm in Garden City, and so those 2 sites is where I operate out of. And then the downtown clinics are walk-in, so those are a little bit more kind of trickier to navigate. But I feel like my 2 sites in the city the clinics are the best option to access care.
And what message you want to give to all the moms?
So I think the most important thing that I want our women in the Asian community to understand and realize is, first of all, you have to give yourself a pat on the back, right? We're moms. We've birthed these children. That in and of itself is a huge task, right? I always joke with my family that I'll always have spent 9 months extra with my daughter. Nobody else got that time except me. Once she was born, everybody got that time with her. But that 9 months between me and her was our time, right? So I think moms need to really sort of commend themselves on all the good work they've done. And so that helps empower themselves. And then they need to remember that it's, again, step by step, day by day. You have to be able to have that presence of mind and that open communication with your children. I don't think there's any other way to put it, you know. For example, like I'm strapping my kid in the car. You have to go, you know. I have to get here today or whatever my schedule is for the day. And then I just stop for a minute as I put her belt on and I just look at her. And I says, you know what? I love you. It takes a second. But it makes a big difference to that kid because they see you, right? You have to look at them. And so I think that presence of mind and keeping that open communication, especially for our Asian community, especially for our women that maybe weren't taught that.
And working women.
And working women, yes.
To run.
And there's so much to do, right? You have to run your house and dinner and meals and everything, job and laundry. And there's just, so asking for help is important, but also just keeping communication lines open. I think the biggest thing, the change we need to bring to our families is that, at least if I look at my childhood growing up, that's the change I'd like to see in these future homes and these future generations.
So to end this conversation, I just want you to share one thing you learned from your mom before we say bye to our kids.
So my mom, I think the most important thing I learned, I feel like I'm a spitting image of my mom, not just physically. My mom never takes no for an answer. So my mom is the woman that just told me to go, go, go. Like, it took me, between my med school and my residency, I waited 3 years to get a job. I had no job. And I had my degree, but I couldn't get residency because I trained in the US. And the biggest pillar of strength is my mom, because she was like, well, you can't stop now, you have to do it. So find a way to do it, nah. So that finding the way, because my mom came here in her 20s, she's an immigrant, she found her way. And she taught us that even if you're born here, you're gonna face your struggles. So you find your way. And if there isn't a path already there, then make a path so that other people can follow that path. So that's what my mom gave us, is just absolute non-stop willpower.
Wow, what a great insight. Thank you so much, Dr. Kiran.
Thank you for having me today.
We'd love to have you again. This is a great wisdom you have shared.
Yes, thank you.
And your experience. And I like to request all our audience, and especially moms. Moms play a special role in the life of kids. So it doesn't matter, money is important too, job is important, we have to pay bills, we have to fulfill our kids' requests. They want new phone, they want car, they want something else. But don't underestimate the power of your presence, the power of love and attention, which is badly needed. When kids are not getting that love and affection at home, they will find it somewhere else. And they are your plants, they are your seeds, they are your flowers. You need to look after them. That's your job number one as a mom, and it's a never-ending job. Thank you so much, and thank you so much everyone for watching this program. Thank you.
Thank you so much.